I think even as recently as 30, 20 years ago, the primary paradigm that was in the public sector for dealing with folks who had major mental illnesses was one of trying to stabilize symptoms and kind of maintain somebody over the long haul in that state. And that differs from how the paradigm has changed, especially in the last 10 or 15 years, to actually expecting that people can improve not only their symptom stability, but their level of functioning and quality of life. There's more to be gained in the treatment of folks with serious mental illness today than simply stabilizing symptoms and kind of maintaining. There's a tremendous upside that's being recognized, and that theme is a part of a lot of evidence-based practices that are being put into play in the treatment of folks with major mental illnesses, co-occurring addictions, past histories of trauma. So, for example, 20, 30 years ago, folks who had major mental illness and serious addiction were oftentimes not considered to really be treatable. And with the advent of integrated dual disorder treatment as one of the evidence-based practices that a lot of providers in the public mental health sector are implementing successfully, we're seeing folks, tremendous upsides being realized as people are able to stabilize the mental illness symptoms, bring the addiction into remission, and then start building a life that many of them hadn't dreamed to be possible, and certainly hadn't been possible before having good integrated care. Another treatment initiative that's gained a fair amount of traction, beginning to gain traction, is working with folks with histories of trauma who also have a major mental illness and or an addiction. I think the paradigm, the old world paradigm as I'll call it, was that you shouldn't mess with somebody's trauma history if they have these other conditions, because to do so would destabilize their mental health symptoms or destabilize causing a relapse with the addiction. And now thankfully there are some good evidence-based models that are being put into play that are taking those risks seriously of not destabilizing somebody, but also not ignoring treating the trauma in a way that helps free people up from some of the symptoms and after effects and allows them to live a higher functioning and more satisfying life.
Along with that, one of the things that John had mentioned, talking about being out in the community and working in the community, and is that seen as also part of what someone does in their recovery that is a helpful way to find reasons to be stable, maybe to stop using substances, to either take medications that they want to take? Is it wanting to get out there and be employed and be doing things in the community instead of waiting to do that later? Is that part of recovery? Is that?
I would say absolutely. We talk a lot about tools in the recovery toolbox. Medications can be one of those tools. Having meaningful, gainful activity on a daily basis, whether it's paid employment, volunteer work, hobbies, whatever kinds of things, absolutely a part of the recovery picture. We talk about major mental illness and addiction as being whole person diseases, and it's really important that treatment address the needs of the whole person as well. There's no single medication or even therapeutic modality that's going to address all the aspects of recovery that a whole person needs in order to make headway, not to mention the motivation, internal motivation that comes from being connected with meaningful things, having goals to aspire to that can help motivate somebody to engage in treatment and stick with it, because oftentimes treatment is difficult work.